Hi, this is Jamie, and welcome to this episode of Over a Cup of Coffee, where two friends talk about everything under the sun, all over a cup of coffee. We're so glad you're here, and we can't wait to share this episode with you.
Hi, I'm Addie, and welcome to the next episode of Over a Cup of Coffee with Jamie and Addie. We are very excited for this next episode and the very important topic that we're covering today.
That's right. And for our listening audience, we're here in Farmington, New Mexico, and we do a podcast that's called Over a Cup of Coffee because we came up with it over a cup of coffee, and we like to talk about everything under the sun that we can talk about over a cup of coffee. So I got to give a shout out on my coffee mug for those of you who can see on Facebook, because I was running around as usual before we filmed today, and I realized I'd forgotten my coffee mug. So I went down to one of our local stores. You know, I'm all about shop local. It's called Artifacts, and they have a number of artists that do paintings and pottery. So I rushed in there. I bought their last pottery coffee mug. They filled it. They actually washed it out for me, too, because they've been sitting on the shelf for a while. So I really need to give a shout out to Tara and Bev down at Artifacts for saving me today. So, but we are super excited. So, Addie, do you want to introduce our guests?
Yeah,
great.
Yeah. So,
great.
We have in person, we have Kathy Price, one of our close and dear friends and community leaders, I'd like to call you. She's always involved in a lot of things, but we will let her explain that. And then by Zoom, we have Dominic Cappello. I'm sorry, I should have practiced like Jamie did. Dominic Cappello, welcome. Thank you for joining us by Zoom, and the beautiful city of Santa Fe. And we look forward to hearing everything you have to share with us today, too.
So we know we have about half an hour, so we want to get most of it to the two of you to talk about community. And the purpose of this podcast is building positive community no matter where you live. So we have listeners from all over. So this is a topic that obviously 100% community. So I'm going to let the two of you sort of take it from here about what this is about, what this is initiative, why it's important, and what it's about.
Well, I'll start off. I'm Kathy Price, and in January, I'm a lifelong educator from San Juan County, and I grew up actually in Santa Fe and lived in New Mexico my whole life. But in January, I started a grant through our new early education and care department. And I'm a regional child care coordinator, and I have to work with early childhood and child services. And my territory is large in north central and northwestern New Mexico. I was talking to a man by the name of Diego in Espanola, and he said, well, we do 100% community. And I said, well, what's that? And that started the journey that led me to Dominic and his amazing team that are housed out of NMSU. I read Anna, age 8. I've started talking to people, and I think this is something that will really change a lot of lives in San Juan County.
So Dominic, can you, for again our listening audience, NMSU stands for what?
New Mexico State University.
Thank you. We get caught in a lot of acronyms, and sometimes we forget that not everybody knows what the acronyms stand for. So do you want to give us an overview and kind of launch us off here?
Well, sure. I think the overview, I love that the theme is community. And I think that our nation is really at a crossroads. I would say a tipping point. I think we are being hit with so many crises, and whether that be the pandemic or another type of pandemic, or the economic distress and disruption, loss of jobs, all this adding to everything that was coming before, which was poverty, lack of access to resources, childhood trauma, family trauma, all the things associated with that, substance use disorders. You know, in New Mexico, it's a long list of challenges only made worse by the pandemic. And I believe, and my co-author, Dr. Catherine Ortega-Courtney, we believe that we have a choice in terms of community. I think we either become a culture of caring or a culture of denial. And we believe that we're right there. We're right there. We wrote 2 books. The first one about childhood trauma, which is really about family trauma, called Anna, Age 8, and I can talk more about that. And then the follow-up book to that, because people said, we have to do something about this. And we said, well, I guess we better write a manual on how to do this. And we called it 100% Community. So those are the 2 books that are guiding the initiative that we now lead called 100% New Mexico. So obviously there's a lot to talk about, but again, I believe we're talking about community. I believe we're talking about local community and our capacity to care and to show altruism and the selfless caring of others. I believe that's where we're at.
Oh, yeah. Yeah, I definitely agree. And I think we are at a tipping point in each of our communities where we all need to pull together so that nobody's getting left behind any further than they already were to begin with.
Right.
And,
right.
And, the 10 vital services, I really want to be able to hear about those and our listeners to hear about those because they're so important because, again, prior to 2020, there was already a serious crisis, in my opinion, going on with our less fortunate or our underserved people in our communities. And I think with these 10 pillars, if we can get the right people involved, and which is yourself and Kathy and Jamie and I and other people that we all work with, it can definitely be something that works for all of us.
And one of the things that I also found out is we have good people doing good things that really care.
Yeah.
But they're really silos. Like, okay, well, I'm working on this, but I can't give food away if they don't have transportation to get there, and if they have transportation but no money for gas to put in there because they don't have a job, and then
right.
So everything has got to be interconnected. So these good works that people are trying to do really cannot be as effective unless we can all really work together and have a hub of services and really address each of those together.
So you mention, or you talk about the vital services. So do you want to touch on what those are quickly and so at least we can get them all in, and then if we can go back and expand a little bit during this time, we can do that.
Yeah. Well, Catherine and I, when we were thinking about the book, we're researchers, we're data people. So we know from our work with child welfare what our most vulnerable parents require. But we also know what all our parents require. And we were looking first at, well, what are the services a family needs to survive, just to survive the week? And we talked about, well, you need food or a food security program, or a housing security program. You would want access to medical care, especially in a pandemic. You would want access to behavioral health care, again, especially in a pandemic and economic disruption with lots of stress. And you need access to transportation. Otherwise, you can't get to these services. So we call these the 5 surviving services. And these are the services that are connected, right? They're all connected. And in a community, we talk about how is everyone talking with one another, the people who provide these services. Now, obviously, we want to move all of our families from surviving to thriving. We like the thriving area. Those services would be parent supports, and that would include home visitation programs, respite programs, parent education. Then we have early childhood learning programs. We have what we call community schools. These are schools, only they're like on steroids, which means they have school-based health centers so families can access behavioral health care, medical care, and dental care. They also have more funding to have more tutors and mentors and to make sure that every child gets what they need in school. And we can talk more about just the school piece could take up probably 3 hours. Youth mentoring would be something that we think is very important. And lastly, job training, because our families need jobs. So as you can see, these 10 services, middle-class people and upper-class people use these services all the time. We don't think about it. we pull out a credit card. Now, I should say that was until the pandemic, because many of us who are middle class are learning that our jobs aren't so secure. You know, there are government jobs that we thought we would have forever, but people are being furloughed. So the middle class is learning that we're all pretty vulnerable. We need to take care of one another. So it's about all of us. And that's why I like the term 100%. It's everybody, right? We want to take care of everyone in your county. And I bring up the county because our initiative is county-based. We focus in on a county and we help that county connect all the services, measure the services, and make sure they're available for 100%.
So it's an interesting dynamic that we have going on here right now, because as you're talking, I'm thinking not only are we coming out of this time of a pandemic and a lot of crises, like you mentioned, with stress, mental health, physical health, well-being, but in our own little area of the state, since we're talking about New Mexico, we are, I guess, can you hear me, Dom? Okay. We're coming out of we're still in the middle of a very interesting transition time here in the northwest corner of New Mexico, because much of our traditional economic base is changing with our oil and gas jobs leaving. And I'm just going to bring up one example. We do have one of the energy stations, San Juan Generating, getting ready to close, and that could be the loss of 1,500 jobs, which adds stress to an already stressful situation. And I bring that up because sometimes we talk about all these wonderful things, but how do we, well, I'll just ask the question, how do we pay for it? I mean, I'm just going to ask the obvious question, because all of these are wonderful things in the community and things we all need, but I look at what that loss of jobs might mean, and that's going to add more stress into those families. That school system, Central Consolidated School System, that's a major piece. I think that's their entire tax base.
I believe it is, yeah.
And those support services that, again, rotate around those jobs. So that's already kind of an impact. So I'm just kind of asking the question because I'm interested in the conversation. So what are your thoughts on that, Kathy? You live here. You're very aware of this situation.
Well, I think we have to get very creative on how we use the available money. There is money out there, and there's right now, because of the recovery funds, so much money funneling into our area. Do we use them wisely? Do we use them? Do we have a plan? And it's got to be data-based. And that's why I really like the whole flow that 100% Community does, is because you start with the data, and you're not reinventing the wheel. If you've got good things happening, and there are some good programs happening, bring them in. You know, I'm already working with early childhood, and we have an early childhood coalition in our county. Let's bring them in, and we become the early childhood team, and we'll, work with the schools. And Farmington schools are already starting community schools. So let's just build on what we have and utilize our money wisely. And there are a lot of grants available, and we've got to build that capacity is here. We just have to tap into it in a creative way. Don't you agree, Dom?
Yeah, I to be quite honest, I've been in this field for a long, long time, and it's never really been about the money. It's actually been about the priority and where we spend the money. Cities have money, counties have money, states have money, the feds have money. Does it ebb and flow? Absolutely. But there's always been money. But what I learned when we were working with 100% Taos is they said, our budgets reflect our values about our children. If our children are important, we're going to look at our existing money and make sure they're the priority. We'll make sure these services work for them and their families. So I would say that what we want to look at today is your city budget. We want to look today at your county budget. We want to see where they spend money. It's about spending money prudently, wisely, and as Kathy said, with a lot of creativity. In our book, we list about, per sector, we list about 20 to 25 innovations that you could begin with now. And a lot of these don't cost money, but it is about working differently, right? So the opportunity here is creativity meets compassion meets caring, and that's how we get through this. But hearing of your potential job loss, we need to get started today. We really need to be looking at, let's not wait for these people to lose jobs. Let's Let's get the job training thing going. Let's get those food pantries up and running. Let's get these services there, and let's see what resources are available. I guarantee you, once you start our initiative, we work with you on this very issue about where's the money, and also how do we bring in the private sector? Because a lot of our solutions are public-private sector partnerships, and so there's incredible opportunity here, but it comes back to a culture of caring.
Mm-hmm. Yeah. Good point.
Yeah.
And that comes back to relationships. We have to know the people and have the trust. And so I first talked to you guys at a chamber event, I think, about, hey, have you heard of 100% community? And so it starts of getting the word out. And I invite anybody. You don't have to be working in one of those areas. You can just be a concerned citizen, but let's meet over a cup of coffee and let's just start talking about it, because that's the beginning part. And then, well, hey, are you interested in Age 8? Or do you know what childhood trauma is? Or maybe you're interested in transportation or housing or food services. But then use that as a starting point to build that, as a catalyst to build that awareness. And that's where we are.
So let me ask you this, Dominic, since we do have listeners that could be anywhere in the United States or the world, but I like to think the world. But anyway, it is a podcast. Is this something that anybody listening in a community could take this model? You mentioned Taos, which is also in New Mexico. You're in Santa Fe, which is in New Mexico. But Dom, are there places in other communities where they could access this book and take this same model into their community so it would be applicable everywhere in the United States?
Absolutely. As I said, this is a county-based model. And we know the United States really well. I'm not going to claim to say I know how this would work for Sweden or Taiwan, but I think the model would work for any group. But again, it's about local, however you want to define that. And here in New Mexico, we're in 10 counties right now, and they're all at different levels of development, moving with the initiative. But yes, this is a model that could be used anywhere for any locality that believes that every child should thrive and every family should be supported. I mean, it starts with values, right? I love what you said earlier. It starts with relationships, business people, elected leaders, people working in childcare and education. It's a very big tent, right? With 100%. There's a place for everybody. There's a place for our high school students. We have a whole project here that's public awareness, which has to do with doing murals across the city, getting 10-year-olds involved, and getting them engaged in altruism, right? Introducing them to the concept of taking care of your neighbor. So that's what this initiative is all about. So yes, we can go anywhere. And our thinking is we want to first be in 33 counties in New Mexico and be super strong. Then we just have about 3,000 more counties in the United States, and then we'll consider going to Costa Rica. All right. I'll tell you what, I think we're going to wait till you invite us into your county, and then you get us a little bit closer to Costa Rica.
Okay. So I'm going to ask Addie if you have any questions. But I mean, because I know I keep jumping in.
No, you're okay. Well, and then your background, you're very familiar with a lot of these services because of your previous background. So I was also very curious to know, what your thought processes would be with this, because I know the hurdles that you saw and worked through during those years.
Right. Right.
But I'm always about doing the right thing and community and those relationship building. That's how I build my businesses, is through relational building, and how do we bring the next person with us and keep that going and share that value. Yes, losing jobs at the capacity that we're going to be losing, possibly going to be losing if things don't pass the way that we need them to for this upcoming change. How do we fill that in? I know Jamie and I work with Four Corners Economic Development, and we've done something similar to what you guys have in the 100% Community book, where we have done interviews with different industries and leaders in those industries, looking at what are our shortcomings in providing jobs and creating new jobs and keeping families here. And as our students come up through the education system, how do we entice them to stay here and go to our community college? How do we entice them to stay here and join our workforce rather than moving out? And if we're falling down at the family level, but they're going to want to run. They're going to want to leave. They're going to want to get away from that dynamic that isn't thriving for them, and maybe not even surviving because they're struggling every single day. So, so it's a huge conversation and a huge topic that can be daunting, I think, and is possibly why the people who are in just human services, for instance, the health and welfare, those people are overwhelmed and inundated with huge caseloads. And how do we look at them and go, I know you're completely stressed to the hilt and you're probably going home and doing things to numb yourself out because of everything you're working toward. How do we spark their fire again for the love of why they got into what they're doing to even make this make sense for people? Because I know that I can get busy on something that's personal to me and then overwhelm myself really quick. And I'm just one person working on one little thing. And so, when we've got 100 people depending on us to help change their lives, how do we fire them back up?
Right. So I worked before I came to work for the Chamber of Commerce as the director, I worked for an organization here in Farmington for 12 years as their development director, which is Child Haven, which is an emergency shelter for infants through 18. And they have a foster care program. They have a CASA, which is a court-appointed special advocate program. They have a nurturing or positive parenting, child advocacy services. So kind of a lot of wraparound services that came out of what you were talking about, very similar to Anna, age 8. Growing up, my mother was a social worker. She was a child protection worker. So my whole life, my grandmother was also a social worker who worked with women in situations that were, she was in Southern California, but anyway, my grandmother was a social worker. My mother was a social worker. I worked for Child Haven. So I feel like throughout my whole life, I've had a lot of personal experience with this. But the question I get a lot and how I began to feel, and donors who supported programs said this: there's so many programs. There are so many wonderful things. There's mentorship. There's the court-appointed special advocate. There's Child Haven. There's Family Crisis Center. There's the mentoring. And where are we making progress? Why aren't we making a huge dent in this problem when you look at all these different programs going on? So that's the question I'm curious about. Why aren't we making this difference with all these things that are currently in place? I'm going to throw that out to you, Dominic.
That's the question, Hannah. Kathy said we are unique in that we are a data-driven program. We don't work on hunches or guesses. So the first thing we do when we are invited into a county is that we do a countywide survey, and we ask parents and youth and elders, to what degree do you have access to the 10 vital services for surviving and thriving? And if you don't have easy access, why don't you? Now that data becomes a report, and let me tell you, it's eye-opening. For example, in Rio Riva County, 50% of families who said they were seeking behavioral health care can't easily get to it. 30% can't get to medical care. Almost 50% can't get to job training. It's a long list, but here's the good news. With the data, because we know where these people live and their zip codes, we can now look and see. So they're saying they can't access, or they can't get transportation, or the cost. We can now see why they can't get to services. So we can be strategic. I mean, we do work like a business. I mean, we have a business mind here in terms of, let's be very clear about agencies that look good on paper, have a great website, but you know what? It's just not happening. So I would say that our nation and our state, of course, we have built amazing nonprofits and amazing services. One problem, we're siloed. We don't talk to each other. And the other is we don't use data and share it with one another. When we started this initiative down in Doñana County, the mayor pro tem, Cassandra Gondara, convened people from every sector. We had about 150 people in a room, and many of them commented saying, I've never been in a room with people with other sectors. You know, I work in transportation. Why would I be in a room with someone in the medical community? So all these people serving the same people, but never talking to one another or coordinating services. So I think our opportunity here is to work really in a very smart way, in a very data-driven way. And we measure everything, right? So I think that you have the players in your county. They're there. All we need to do is get them working differently, right? Get more innovation in. And I do believe from a business point of view, we've got to take care of the digital divide. We've got to make sure everybody's got access to the internet, because that gives us more opportunity for web-based businesses. And that's where our opportunity is for growth. Young people looking to be entrepreneurs, you want them to stay, and they will stay if they can make money and have meaningful work. So think of us as economic development, health development, family development. 100% community really is win-win for everyone, for the business sector, the public sector, for families. So that's my very long-winded response, but we've got to go back to data. The numbers guide us, and research informs what we do. And I think that is what is radically different about 100% community. It's not just our guesswork. It's all grounded in science
and data. Mm-hmm. So we do definitely want to we know that we're coming up to our time, our half an hour. Mm-hmm. And so just as we get ready to wrap up here, any closing thoughts? I'm gonna have Dominic first, because I know he's got another appointment and he'll have to leave. But then we'll start with Dominic and then Kathy, just for some closing comments. So what would you like to end with?
I'd like to end with how I see the work. If you think of your county, just imagine in your mind all the families who live in your county right now, all the kids, the elders, everyone. Think of them as moving through a process. There are a lot of people who are hurting. There's trauma and a long list of things we're all very familiar with. From hurting, people move to hiding. And by hiding, I mean a lot of us, when we're hurt, we don't want to feel the hurt. So there's alcohol, there's recreational drugs, there's prescription drugs. It's a long list that allows us to hide. So we have to move from hurting to hiding to healing, right? We need to put in those services that allow us to heal. But there's a fourth step, and that's helping. I want to believe that as we heal as a community, we seek to help others and lift our neighbors up. So think about moving from hurting to hiding to healing to helping. See all your community members being supported through that. If we work together through that process, you'll be living in a very different world in just a few years. So we've got some hard work, but we've got the steps and we know how to work together through it. I just want you to invite us to the 100% book club.
Okay. We always do a book review as part of this. And I read Anna A. Jade, and I found it, of course, very impactful in the stories, but the overall theme of it. And of course, data. I don't like the word data. Data scares me. I'm a big picture person. I'm a story. I like the story, but data is. So this was but you're right. We can't make the solutions if we don't have the data, and it does need to be data driven, because that's how you measure your outcomes. So I get it. Kathy, some closing thoughts from you?
I'm here in San Juan County, and I'm 100% in. And where does it start? It starts with conversations. It starts with a cup of coffee. We have wonderful coffee shops all over our county. Mm-hmm. I'm flexible. I'm available at this stage in my life, and with the work I'm doing now, is to have those conversations with parents, with business communities, with outdoor people. It really doesn't matter what your background. If you have an interest in this, let's start talking, because it begins with that. We share information, we read books, and say, okay, let's get it done, because I'm a high energy. Let's get it done, girl. So as you all well know, we all wear many hats, but that's okay. The tin services kind of fits my personality. So I really appreciate you enabling us to share this. And Dominic also has been a great resource, and they'll be up here. And as we, move out of the pandemic and things, it's like the action's going to continue.
That's great.
Yeah.
Addie?
Yeah. No, I think this was wonderful. I think it's a of course, it's Kathy and I've talked about this, and Jamie too, near and dear to my heart, to the things that I work through personally and professionally, and I want to definitely see this conversation continue going and growing and getting it up here, because yes, I am data driven, because that's what my job is, and so I know that when I see numbers, I know that I can reach them. So, and that's where it makes sense to me, is getting people in and getting them to see the numbers and see what's possible.
Well, thank you for our audience for tuning in to another episode of Over a Cup of Coffee. Again, one more shout out to Tara at Artifacts for saving me with the coffee mug today. I sure appreciate it. And stay tuned for our next episode. Bye.
Thank you, Dom.